Welcome and thank you all for joining us today in our online session, Responding to the COVID-19 Crisis. My name is Raida Mana and I am a member of the IAVE team. We hope you're safe and healthy during these disturbing times and always. As the coronavirus pandemic continues affecting our world, IAVE is committed to help volunteers and volunteer organizations deal with the challenges it presents. We have prepared a series of webinars and resources to help you best respond to this crisis, including the IAVE COVID-19 Response Fund to support volunteer-led preparedness, containment, response, and recovery activities. This fund will help ensure volunteering organizations have resources to keep critical volunteer efforts strong in this time of such great need. To learn more about how to donate to the fund or apply for a grant, please visit us at iave.org/COVID-19. IAVE strives to build an inclusive network, open to individuals and organizations of all capacities and resources. Please visit us at iave.org/join-now to learn more on how to join us and follow us on social media. The actions of volunteers are essential to support and keep people who live in conflict zones protected and healthy. But doing so can often be incredibly difficult for many reasons. The conditions and the context, the prohibitions and contradictory policies, and the nature itself of the community's needs. Today, Steve Sosebee, the President and CEO of the Palestine Children's Relief Fund, will share some insights on how the organization is responding to these challenges, providing humanitarian help to those who most need it. A couple of important announcements as we start. This webinar is being recorded and will be available in our COVID-19 response website. For questions, please type them in the questions box and our moderator will convey them to our presenter. Let me start by introducing our moderator for today's session, Bill Osborne. Bill is the director of the VSB Foundation and chairperson of the Building Change Trust. The VSB Foundation is a small charitable body primarily supporting volunteering, citizen engagement, and community development. Bill has over 35 years experience of working in the not-for-profit sector at the leadership level. Since 2008, he has been the chairperson of the Building Change Trust, a support fund established by the Big Lottery Fund with a national lottery grant of more than £10 million as an investment for community capacity building and promotion of the volunteering and community sector in Northern Ireland. Thank you very much, Bill, for leading today's session, and welcome everybody.
Thank you. Thank you, Raida, and it's a great pleasure to moderate this session. I sit here today and I look out my window. It's early afternoon and the sun is shining. The garden looks radiant. The flowers are in bloom, and you believe that things are well with the world. And then you step outside. You see people in masks, you see very few people. And you put that against the backdrop of, particularly in places like Northern Ireland and Palestine, where conflict, while here it has disappeared almost, it's still alive, and people still die because of a result of turbulence and conflict between people. This week we've had someone who was shot to death in their own home in front of their children, putting undue strain and use of unnecessary resources on the NHS and our emergency services. So conflict brings with it its own problems, but on top of that, a COVID pandemic where people die of an unknown and unforeseen virus is somewhat frightening. Brought home to me by my granddaughter who lives with us. We live quite close to a beach, about 3 to 4 miles away. And this 4-year-old says, we can't go to the beach because the Prime Minister says you must stay in. And when a 4-year-old says that, you know that her life will be scarred forever with the memory of a pandemic. So it is with great pleasure that I have the opportunity to welcome Steve. His bio will come up. He has tremendous amount of experience of working with children and young people in one of the most difficult conflict regions of the world. So Steve, it is over to you to share your experiences with us, just of how you and your organization is not only dealing with a conflict zone, but also with a pandemic that is likely to go on for the foreseeable future. So Steve, many thanks for taking your time out. And also to those of you who have joined this webinar, many thanks for taking time out of what is a terrifying, frightening, and also for many of you who are committed, busy period to listen to this seminar and to listen to Steve. We greatly appreciate your time. So Steve, over to you.
Thank you, Bill, and thank you for inviting me to this webinar. First, I just want to welcome all of the people who are attending and wishing you all a safe and a restful time during this crisis. We are, just going to show my screen here. Here in Palestine, we are facing some conflicts, as you know. We're under military occupation, have been since 1967. Military occupation here means that all of the controls for movement and for people coming in and out of the country, products coming in and out of the country, are controlled by the Israeli military and the Israeli government, although I live in the Palestinian territory. So that's one of the main hindrances to the health sector here, to the economy in general. And then, of course, we have on a global scale, the pandemic, the COVID-19 pandemic, which has not spared any population in this region, in Europe, in North and South America, so or anywhere globally for that matter. And our organization was established 30 years ago, roughly, first to deal with the trauma and the medical needs of children who were being injured during the first Palestinian uprising. I actually started this organization then, working as a journalist here and seeing a lot of children who needed medical care that wasn't available within the occupied territories. I started arranging that treatment for them for free. And then over a period of time, the organization grew. We started bringing medical teams here as volunteers to provide direct surgical and medical services within the public health sector as volunteers, as I mentioned, but also training local doctors and improving the sustainability in the health sector. And as we grew more as an organization, we started taking on some of the infrastructural defects within the public health sector here. We built 2 pediatric cancer departments, one in Gaza Strip, which we opened last year, and one in Bethlehem, which is the epicenter of the COVID outbreak here in Palestine over 2 months ago. That pediatric cancer department was opened 7 years ago in the name of my first wife, Huda Al-Masri, who passed away from cancer in 2009. And our organization takes on a variety of different volunteering components. As I mentioned, we bring last year we brought 170 volunteer medical teams from all over the world. Those teams come from South America, North America, Europe, parts of the Middle East, Japan, New Zealand, Australia, wherever we have volunteers who want to come and provide their expertise as surgeon or healthcare providers. We bring them over and we put them into hospitals or into training programs where they can benefit the development of the health sector here. And we're the main organization in the world actually doing that kind of work. And we continue to also send children who need specialized care that's still not available here due to the underdeveloped health system abroad for free treatment they can't get locally. And in addition to that, we've been taking on humanitarian projects and programs like developing the cancer departments, providing food, clothing, medicine on a local level for at-risk populations. Now, unfortunately, with the outbreak of the coronavirus, bringing medical teams here and sending children abroad for medical care is currently on hold, for obvious reasons related both to logistics and also to the risks of infection and bringing infections into places like the Gaza Strip, which has so far been spared a large and significant outbreak of the coronavirus, or also into the West Bank, which is, for the most part, not had a major outbreak. We have about 580 cases total here in Palestine, which is not a small number, but something far worse than what we were. I mean, we were expecting far worse, and who knows, it still could possibly happen. But initially, the health system here was, or the health authorities here were prepared for a much worse outbreak. So we've been spared mostly due to the immediate actions taken by the Ministry of Health and the government here to close down the country. But back to the original point, so our organization, were able to kind of shift gears during the coronavirus from our main focus of bringing in teams of doctors and building up programs in subspecializations like cardiac surgery for children, orthopedic surgery, all of these in pediatrics, spine surgery, all the areas which don't exist within the health sector. Our organization provides those services. That's currently on hold, but in the meantime, we've been taking on a significant number of new programs and projects to respond to the coronavirus, both dealing with large projects. We're purchasing digital x-ray machines for the Gaza Strip to be able to help better treat this when an outbreak or if an outbreak happens, testing kits and materials, PPE, supplies for hospitals and for healthcare providers, in addition to some of the food distributions, not only within the occupied territories of the West Bank and Gaza Strip, but also in the refugee camps of Lebanon and Jordan, where Palestinians and Syrian refugees also live in very difficult political and economic circumstances, where they don't have protection from the virus, nor do they have the resources to help prepare themselves for an outbreak. We've been doing this job for a long time. It's the first time we've had this kind of challenge. We've had obviously many challenges here, both related to wars, intifadas, uprisings, closures, curfews, but it's the first time obviously we've seen such a huge shutdown of the entire region, the entire world, and we're doing our best to respond.
Is that you? You good, Steve? Well,
That's
we're
my
hoping.
We'll keep going if you want.
Well, I suppose one of the things that you could tell us a wee bit about would be, how long do you think? I mean, it's very hard to project in terms of the coronavirus, but how long do you think that you can continue to do the projects that have replaced bringing in your medical teams, and what will be the consequences of not being able to do that for a period of time?
That's a good question, Bill. Honestly, a lot of it, so we're a grassroots organization. We don't have any government funding. We don't get funding from any large foundations. We are strictly privately funded through individual donors all over the world. And in addition to the impact that the coronavirus has had on our operations, it also has an impact on fundraising, because we have now 40 million unemployed Americans as a result of the closure. Most of our donors are small individuals who give out of their charitable contributions to help our work, and the economic impact of the closure all over the world is having a tremendous impact on our organization's ability to have the resources to respond. However, with that being said, we still see people giving and supporting our work. They like the response that we're providing to the crisis, and hopefully that we'll be able to continue. So as long as we have the resources, we can continue to provide urgent, direct humanitarian relief. We have offices, small satellite offices all over the occupied territories, 3 in Gaza, 6 in the West Bank, in Lebanon and Jordan, where our staff, field workers, are on the ground distributing aid directly to at-risk populations. So we have the ability and the infrastructure to provide that relief. It's just a question of resources. With that being said, we also are taking on and continuing large projects. We're building here currently, and we have the funding for a pediatric intensive care unit, which will be a brand new center on the roof of the main pediatric hospital here in the West Bank, and more than double the ICU beds in the public health sector, which is crucial at this time. As you know, intensive care beds, both ventilators and services within the intensive care, are a major component for treating the coronavirus and saving lives. So we're more than doubling the intensive care beds in pediatrics. We also have other projects throughout the West Bank, large ones, not just direct individual humanitarian relief, but large projects where we are rebuilding an emergency room in Hebron, expanding an intensive care unit in Jenin, and continuing to run the 2 cancer hospitals that we established over the last 7 years. So we're confident we can weather this storm, but as you said in your opening remarks, Bill, this is going to be the reality we face for the immediate future, and we have to be prepared to adjust to it.
Okay. How many, Steve, volunteers do you have involved across your organization?
So it's a good question. We have 2 types of volunteers. We have the professional medical volunteers who are surgeons or highly specialized doctors and nurses who come here, leave their countries, as I mentioned earlier, from all over the world, hundreds every year, who come and operate on children or provide training for local physicians. And then we have, as a grassroots organization, we have literally thousands of volunteers all over the world who are part of our chapters. So we have 30 chapters who are active mostly in North America, but also in the Middle East and in Europe, who take care of the children that we send to their communities for medical care and who raise funds to support the work that I've outlined briefly in my comments. So as an organization, we depend on those volunteers to both support our work financially through their donations and through raising awareness within their communities, and also the volunteers who come here and implement our programs and projects on the ground.
And have you had to take any particular precautions for local volunteers who are involved in your organization due to the coronavirus?
Well, most of our, yes, so we've actually had to cancel most of our events this is the month of Ramadan. So this is a month for Muslims all over the world who want to give for charitable, this is the month most of them give for charitable, give their charitable donations called zakat. And usually at this time of year, we are raising money through different events where people come together. We talk about the work we're doing, we talk about a project we're raising money for, and we ask for donations, but we weren't able to hold those events this month because of the social distancing requirements and the lack of groups coming together. So, that's been a tremendous impact on the organization. And obviously, volunteers cannot come here, as I mentioned earlier, they cannot fly any longer to this country because of the logistical closures and the social distancing requirements. However, we do have volunteers here in the occupied territories who abide by the same requirements that all of us follow, which is, what are the protocols for social distancing, wearing PPEs, cleaning your hands, and avoiding any potential risk for infection or infecting others. So as long as you follow those guidelines, I think you're still able to, on the ground, as long as you can come here or you're here already, we often ask our volunteers to help out in the distribution of humanitarian support and humanitarian aid.
Okay. It's fascinating, the whole issue of how you manage social distancing. I mean, I'm currently involved with a voluntary grassroots organisation in Belfast in Northern Ireland, and the difficulty we're facing is that we have a large childcare facility which has 80 staff, and they're all on leave because we've had to close down the childcare facility. So the issue trying to bring them back to work with children in a socially distanced environment is causing problems, because there's a baby unit, there's a toddler unit, and trying to work out what's the space, what will be the requirements, is immensely difficult for the organisers, because there's no clarity of how close you can get or how far apart. It's all right for adults, but for children, very, very difficult. And it's likely that this will be one of the last things to open. So there are immense difficulties as we go forward trying to manage our engagement with service provision, particularly where you have to have close contact, and the fears that people bring with them. in terms of, will I pick up this virus or will I be a carrier and take it back into my own home, is also quite frightening for us living with it. Certainly in this jurisdiction, you can feel that fear of people not wanting to get close. And so the whole sort of sense, particularly in a culture where touch and feel and embracing each other is very part of that, is frightening. And for volunteers, part of their essence is the close relationship that they have with people, and that is, it's hard, particularly in the context we're now working, where you might visit someone who is self-isolating, an older person, and you're taking them food, but you leave it, at the bottom of their gate, and you talk to them from a distance. That is it's very emotive, because it's not our natural way of doing things. So are you similarly facing that in parts of Palestine in terms of the work that you're doing?
Yeah, I mean, it's having a consequence and an impact on all aspects of life, as it is, as you just outlined, in Northern Ireland. Here in Palestine, in the Arab culture, handshaking and even more the kissing on the cheek, which is customary when people greet each other in this part of the world, has all stopped, and it's been a struggle for people to adjust to those forms of kind of social distancing when it's such an embedded part of their culture. But this is the new reality people have to adjust to. And as I mentioned before, the government here has done a very good job, the Palestinian Authority, to kind of regulate and control the outbreak of the virus. And part of that has been imposing very strict social distancing rules. And people have abided by them. I mean, the Palestinians are used to hardship. As the people of Northern Ireland are as well. They've lived under curfews, they've lived under closures, they've been imprisoned in their homes before. I remember during the Gulf War, they had a curfew on the West Bank for 6 weeks when people couldn't leave their homes for 6 weeks, imagine. And I remember when I first came here 30 years ago in Gaza, there was a curfew every night at 6 p.m. when the soldiers would, if you were on the street after 6 p.m., you could be shot. So Palestinians are a little bit more, let's say, I don't want to say accustomed, because these are not normal conditions that anybody should live in, but they've gone through it before. So as opposed to where I'm from, the United States, and you see how anxious people are now to kind of put aside the social distancing requirements to keep the curve flattened and get back to living what they consider normal lives after just a couple of months of sacrifice and isolation, or limited isolation. Here in Palestine, people have been patient. We haven't seen any major effort to break the social distancing customs. And part of the reason, I mean, let's remember, first of all, the Gaza Strip, which is 2 million people, is what has been called the world's largest open-air prison. And that open-air prison for years has denied them the basic human rights of travel and living, and having access to medical care, food, job opportunities, education. They've been living in a place that is one of the most congested and densely packed places in the world, surrounded by barbed wire, walls, sniper towers, and the Mediterranean Sea on all borders. But now we see in the last 2.5 months that this has also benefited them, because the population, they're being so isolated, there hasn't been any large outbreak, or they could control the access into the country and ensure that whoever is entering is not bringing with them this deadly virus. So here in Palestine, and we have also where I live in the West Bank, we're surrounded by a wall. The wall was deemed by the International Court of Justice as being illegal, a violation of international law, but it exists. And that wall has also helped to isolate the Palestinians from a much larger outbreak in Israel, where tens of thousands of people have the coronavirus and over 100 have died. We don't have that same number here in the occupied territories. And most of the people, about a third of the infections that we see in the occupied territories, are workers coming back from Israel. The Palestinian labor force is very much dependent on providing manual labor in Israel. So most of the infections that we've seen recently since the initial outbreak, which was brought by tourists from outside into Bethlehem, were from workers coming back from Israel. So controlling the access into the country has also enabled the Palestinians to keep the outbreak from being as widespread as we initially feared.
And interesting sort of political ramifications that are not pleasant to have enforced on you, but actually in a situation like this pandemic works to your advantage in many respects. And it was a sad reflection of the world that when you can say that a wall which was illegally erected actually is beneficial in these circumstances. There's an irony for me in that which is says something about the world in which we live. Certainly in our context in Northern Ireland, we face where we live on an island. We have the political dimension of those who are more akin to want to follow the British model of intervention, and those who are saying because we're an island, it should be an all-island strategy. But of course, that takes you into the geopolitical ramifications of an all-Ireland solution to problems, and there are those who are reluctant to go down that route because it creates an island mentality as opposed to a British mentality. So, underlining that, people still get bound into their political tense rather than actually look at it from the point of view of people are at risk and what is the best methodology to stop the virus spreading. So there are tensions in areas of conflict which probably are unlike other parts of the world where those tensions may not be in existence. So it's interesting to hear your perspective on things like the wall and the hard reality of trying to get into Palestine, how that's been of benefit. I'm looking to see if there's any more questions, and there are very few coming in. One that I did have earlier was, do you ever in your organization deal with Palestinian children in military detention? And if so, how do you handle this as an organization?
Yeah, it's a very good question. There's hundreds of Palestinian children in Israeli prisons. Most of them are political prisoners, children who in many cases haven't had trial, have been charged and are being held as administrative detainees, which means they don't have to have trials against them. The military can rule and the court can rule that they can be held without any official charges and therefore not able to mount any kind of legal defense. With that being said, unfortunately, our organization is not able to have access to provide any type of health services or humanitarian aid for children who are in Israeli prisons. There are some organizations here who, particularly the International Red Cross, who are the official bodies who have access to political prisoners and other prisoners here in the occupied territories. However, any child who comes out or we have access to, regardless of their religion, we have here Muslims and Christians, regardless of any type of other factors, we help on a humanitarian basis. We don't help them by giving money, we help them by providing humanitarian aid. If a child is sick and needs medication, we will buy that medication. If a child needs an operation, we will provide that operation for free. And therefore, we're able to control how any type of donation or funds are utilized to help that child, to make sure it's all transparent, legal, and efficient.
Okay. I have no really further questions, Steve. I just want to thank you for your presentation, for your insight. Wish you well, because the sector, I mean, the volunteers will be willing to engage, but restriction of movement will put your organization, like most, more at risk. It's in the UK, it's reckoned that you could see a third of the voluntary sector charitable organizations disappear because of lack of funds. Yeah. Globally, as you have indicated, unemployment is going to rise, particularly in those countries where they have previously been quite affluent, and they're going to then not have the income or disposable income. So this sector and the work of charitable bodies throughout the world, I think, will start to see some effect of lack of income. So it is going to be a difficult journey for lots of organizations like yours, but the volunteers will continue to come but the issue will be the freedom of movement, not because of restrictions of not being able to access, but because of the pandemic. And until we work through that issue, it's going to be very difficult for volunteers to travel globally. So I wish you every success. And right, Ida, I think you want to say a few closing remarks.
Thank you, Bill, and thank you, Steve. Before I go to my closing remarks, Steve, we have a question about the specific actions and programs that you've put together to respond to COVID-19. Is there any action that you would like to highlight as we close the session that has been particularly effective or that has gained more traction during these times?
Yeah, thank you. That's a very good question. So, I mean, I'm happy to share my screen if that's something that you're able to look at. So obviously we were all kind of caught off guard by the immediate spread of the disease in early March. And let me just accept this here. And so we had, as an organization, have to respond immediately. This is our website. And we created a page called to highlight some of the stories we've been doing on the COVID-19 impact. So while we were running all of our other projects, which are, as I mentioned before, medical missions, sponsorship of orphans, identifying kids who need surgery, sending children abroad, we had to kind of refocus and immediately change the ship a little bit into the COVID response. And you can see the dates on some of these stories. April 28th, we've been providing in refugee camps infection control supplies. We identify at-risk communities, whether it's elderly homes, provide PPEs for healthcare providers here in our cancer departments and other places. You can go and check out all the different kind of stories we've been doing here on the ground. That's our staff who obviously take care of themselves to ensure that they are abiding by all social distancing requirements. We provide sterilization services for our cancer departments. These are all just stories we've done during the COVID-19 crisis. And the big one that we initially did was to raise nearly $300,000 for digital X-ray machines to be shipped to the Gaza Strip. So we're also working on bringing in ventilators and all the other required materials, hopefully to support the testing and the containment of this virus. The main thing now, the Palestinians, the only chance they have, and this is true for a lot of poor countries and under-resourced countries, is the containment. Once there's an outbreak, they're going to be in a terrible crisis mode. So, especially in a place like Gaza, which has 8 huge refugee camps from 1948. I visit those camps frequently. Some of them are over 100,000 people living in one of the most densely congested areas in the world, with open sewage, with the lack of clean water. 95% of Gaza's water is undrinkable. There's only 3 to 4 hours of electricity a day. So it's a ripe environment for a terrible outbreak once the virus takes root in those locations. So the containment factor is the big one that we're all working on here. And whatever we can do, we provide hygiene kits to the refugee camps, to people who don't have the resources, as Bill mentioned earlier, because of the economic situation, the consequences of the crumbling economies all over the world. They don't have the resources to provide their families the protection by buying basic infection control materials. We provide that. We provide food. We're providing urgent direct relief. The long-term sustainable support that we like to focus on, which we're continuing to do with the building of the intensive care units and the other projects I mentioned earlier, kind of have to take a little bit of a backseat to what the urgent needs are right now, because this is such a serious and potentially devastating period that if we don't try to contain it, then the consequences could be tens of thousands of deaths here, or even worse, and a complete collapse of what already is a very shaky and fragile health system.
Yeah, thank you very much for that, Steve. And I'm gonna convey one last question, and I would like to hear from Bill about this as well. We have someone asking, in times of COVID, the NGO sector, and not to mention specifically peace building initiatives, it seems that they have been pushed to the end of the priority line. how to attract attention of government and keep building initiatives that strive for peace building important instead of having them become more radical in these times.
Mhm.
Is that for Bill or is that for me?
For
Go for it.
both of
Go
you.
for it,
I
brother.
mean, I think it's we would like to get a perspective on how to keep peace building initiatives as a priority right now.
I suppose in where I sit, the emphasis has been on twofold. One has been on trying to contain and deal with the virus, and then the economic issue, trying to fund and support the economy so that it will at least have an ability to survive once they come out of post-COVID. So British government, the Irish government have invested quite a bit of money in trying to keep people in jobs or furloughed by paying their salary. So that has been beneficial in the short term. People have an income and are able to survive. Long term, the economy is going to go to rock bottom in Ireland and in the UK, they say. They're predicting, what we haven't had before, high scale unemployment for quite a long period of time. So the issue for where the emphasis has been on dealing with the virus and dealing with then the economy. In the midst of that, there's also been this response to support and encourage volunteering. But to do that, you need to have roles that people can do. And then you've also got to give them the protection to do those roles. And so here the infrastructure body set up their website, but they had to close it because they had more inquiries of people wanting to do stuff than they could find suitable opportunities for them all to do. They've reopened it now that they've been able to manage it. So it's about managing the volunteer effort and giving it the proper support. In terms of peace building, I suppose peace building takes in Northern Ireland context a secondary role when you have a major outbreak of which is affecting communities. Communities' resilience comes together, and it's a bit like Steve said. Some of the communities which are worst affected by the COVID pandemic are impoverished communities. Those were the same communities that were impacted on by the conflict in Ireland. In North Belfast, where I'm currently working, it was one of the areas which was severely affected by sectarian murders, but it's also riddled with pockets of poverty, immense poverty. And that same community has a resilience where, because of their ability to cohesively work together, they respond, they put in place food banks, they look for support, and government, in a sense, is responding to that by investing in that. Now, that may not be peace building, but it's helping people to have a view of life and an engagement in their community, which hopefully will transcend into working with their neighbouring community, which may be of a different cultural, religious grouping. And through that, relationships are built. People are fighting a common enemy in the pandemic. People are suffering the death, not because of terrorism, but because of a virus. And so therefore that will bring hopefully bonds which will help in a healing process through peace. So in that sense, I'm not so worried about the peace building being a secondary. We've got to have the priority of dealing with the virus and looking at how you help particularly impoverished communities who are struggling cope and manage their way out of this, and investing in them and supporting their voluntary efforts builds their resilience. Over to Steve.
Well, the issue of peace building here is not necessarily related to the current crisis that we're facing. In fact, the problem here continues to be the lack of any type of peace process. On the contrary, the Israeli government's now taking measures to annex part of the West Bank in violation of international law, in violation of UN Security Council resolution. So what we're facing here is further encroachment of the Palestinian territories by the Israeli occupier. This will only fuel further extremism, further violence, further suffering on all sides, and put the prospects for long-term peace even more further in the distance. So this is, and this affects obviously all aspects of life here, including the response to the coronavirus and the COVID-19 pandemic. When you have these kind of unilateral measures taken which are affecting the life and the prospects of a peaceful settlement between the two sides, which the annexation of the West Bank by the Israeli government is going to do, the cooperation, the communication, the trust between the two sides to work together, even though they live on top of each other, this will obviously make it even more difficult to bring any type of peace and settlement here, and only further fuels extremism and violence.
I wanna thank Steve and Bill for their time, for sharing their experience and their expertise with us today, and for sharing the perspective of what's happening right now, but also what's to come. We know these are very busy times for those doing actions on the ground. So thank you very much, Steve, and thank you very much, Bill, for sharing your insights with us today. For IAVE, it's very important to learn about the stories of every volunteer in the world. We're an organization that does advocacy for volunteering in all of its forms, and we're here to help. We have put together a series of resources to help volunteers and volunteer organizations to respond to the coronavirus. We invite you to go to our website at iave.org/COVID-19 and review those. We will be uploading a recording of this session. And also, we want you to join us. We are a membership organization that grows only with your stories. So we want to be able to share the stories of every volunteer in the world, of their impact and how they're transforming their communities. With that, I'm going to say thank you to everybody who has participated this morning here, afternoon or night, wherever you are. And thank you once again, Steve and Bill, for your time, and all the best of luck with what's to come.
Thank you.
Thank you. Thank you for having us.
Thank you. Thank you.
Will you share the link with us when it's ready?
We will, yes. We'll send you an email with the link, and we'll also upload it to the website.
Great, and I'll share it that way as well. Thank you so much.
Perfect.
Mm-hmm. Thank you, Bill. Nice to meet you.
Thank you, Steve. Nice to meet you. Good luck.
Good luck. Good luck. God bless you.